There we go. We are back with Fellows in Focus. I'm Alex Boucher, one of the Associate Program Directors for the Adult Hematology Oncology Program for Fellowship. And today we have Nath Sumransub. He is here to tell us about himself and give us an idea of how he got here, what he's gonna, what you're doing within the division and what's the future look like. So,
all right.
With all that introduction done, tell us a little bit, or tell me about your background, about your upbringing, before you came to Minnesota.
Yeah, so I was born in Thailand and originally from Thailand. I did medical school there. It was like a 6-year system. Right after the right after the school. Um, so and I worked there for I think it was 4 years. I worked there for 4 years. I spent a whole year, like 1 year in underserved area, and then I moved back to my medical school and work as a research fellow in Department of Immunology. Then I moved here for the residency and stay on as a fellow.
Yeah, so you already had some hematology experience before you even came to the US?
Yeah, it's more like an immunology, like a cancer, more on oncology. So I had some project on like cancer immunology, cancer immunotherapy at that time.
Got it. Which part of Thailand did you grow up in?
I grew up in Bangkok.
Bangkok. Okay.
Yep.
So when you were, like you pointed out, you had the educational sort of pathways a little different than the US, certainly. Where along that pathway did you decide medicine was your thing, and then even further, hematology oncology?
I think good question. I think medicine is pretty early on. So the fourth year is like the first year for clinical exposure on the 6-year system in Thailand. So I think it came on pretty early, like around my fourth year in the medical school, that I think like internal medicine would be my thing. And then I didn't see a lot of cancer patient. I think for hematology, oncology is became more obvious to me by the time that I graduated. I had a month rotation at MD Anderson Cancer Center on my 6th year. So got to see something that's totally different from what we have in Thailand, right? Like a very large program, like robust, like transplantation and all the treatment that is available for the patient. And then I think over the year that I worked in an underserved, like it was in like a northwestern area in Thailand, really underserved area, and it became more clear to me that yes, I like internal medicine, and I feel like I think that oncology might cause my attention at that time. I kind of feel like among many fields in medicine in Thailand, I think the field of oncology, hematology is still, we can still make some more, like much more development for the patient care in Thailand.
Got it. So I picked up in that you had been to the US before residency, at least
Yeah,
for
just like
a short
1 month is like a exchange
Okay.
program between the school, medical school, and some of the sites in the US. Correct.
Got it. And I know I'm going to be really breaking new ground here to say that Minnesota's climate is a little different than Bangkok's.
Yeah.
So then what made you make the even further move? You passed Texas, you just kept going, and you ended up in Minnesota for
Yeah.
residency. What
Ended
made
up
that
in
change?
end up in a completely different climate. I think at first the main reason for me is that I think the university, I mean the University of Minnesota, um they accept Thai applicant every year actually. So we have like a good I think the program takes a certain amount of international graduate every year, kind of more like and also there's like a small community of Thai doctors slash resident here. We have like resident fellows, some attending doctors at the university as well. So I think that might be the main reason I moved to Minnesota, to Minneapolis. The weather definitely is totally different, but I can assure all the applicants out there that I came from the the country that can get in the winter is the lowest we can get is like 60 degrees in Fahrenheit in Bangkok, and it's like and everyone like will pull out the cold from the from yeah from the closet and wear it outside. So I can assure all the applicants there that I survived just fine. I mean it's cold in the winter and it's quite long. Like I think it's like 4 or 5 months, but I mean it's not that you are outside all the time. It's just it's completely doable.
I do recall actually when I was a resident too, we had a two or three Thai trainees within each class too. So I definitely recognize it. And then it just becomes this bigger culture, right? Like you said,
Right.
there's whether or not they stay around here. It seems like a lot do stay, but if they do, then it sort of builds out that group.
Right.
And I remember, and this is a little bit of cultural ignorance for me, although I remember some of it. I know that the names that there's some differences between the length. Well, one that the nicknames are always don't necessarily match the first names, but also that the length of the names maybe represents different cultural histories. Is that right?
Somewhat. I think my last name is on more and shorter and easy
It
side.
would seem like it,
Yeah.
but
I think more. I think you're correct. I think the family, if they are from like, if they're from China, like Chinese ancestor or something like that, when um, their last name is gonna be a little bit longer. They want their last name to have a meaning, like kind of like a wonderful meanings about life or something like that. Mine have that too, but it's kind of more like a easy version.
got it.
Easy
How do you, and then
version.
who gives you the nicknames? Is that a family thing that goes down, or
Yeah,
um
just the family, usually the parents.
okay.
Yeah, some might ask like if some parents might ask like some of the monks or something to give their children's name or something like that in my country. But
Yeah.
yeah, my name is from
Well, and
parents.
yours is close, right? It starts similar letters. Some of them I remember were very different, but admittedly, as an American, it was easier to say the nickname than usually their first.
Right. And nickname is like totally like can be completely unrelated to your name or your last name. So
Got it.
nothing related at all.
Got it. Well, now we'll get back on topic. I let us off on a tangent there, but what obviously you did residency here, you had moved here, you had that community here. That and or what were the big reasons to stick around and continue to do fellowship here?
I think from what I saw from the residency, I think the strongest part about the program is that we have multiple sites that the resident and fellow rotates through. So you get quite a bit of very exposure in terms of like patient population, right? The university is gonna be like tertiary, quaternary referral centers. You see more complex cases, but you can see something that you can't see anywhere else, like bone marrow transplantation, CAR T-cell therapy, something like that too. But then in the program, you still get to see more like a tertiary center, like Regent's Hospital. VA have their own like a specific patient population. You get to rotate through like Hessia, Hennepin County as well, which has their kind of more a little bit like flavor of the different like in medicine that you can see. I think the for private practice like Regent's Hospital, you still see some a bit of more and more complex cases, but those are the good case to learn for like during the residency for internal medicine. I think the main reason that made me stay on, apart from that, from very exposure, is that I feel like the program can take me anywhere. If I set a goal in academic career. I mean, the universities are like a large academic centers that has every research opportunity for you. Like if you want to do like a basics research, like clinical research, or in whatever topic, there will be someone that is doing some work on those topics that you can join, definitely. So I mean, I think there's like a lot of opportunity that can serve whatever you are interested in. And then because of that, we have other sites that we rotate through. If you're interested in just like a more like a community practice, not academic practice, you get all the flavor from when you rotate through like other sides of the programs too.
Yeah, I mean, certainly the breadth of experience and the fact that the different hospitals offer very different experiences was something that drew me up here for residency as well. So I'm glad you found that to be the same. You talked about the research and the breadth of it. Can you give me a sense of your research? And because I actually don't know, I'd love to hear about, your research path and what that's looking like.
Right. So and then that might be another reason that I stick here too, because we like a strong hold and a big program for bone marrow transplant and cell therapy. I feel that the bone marrow transplant is like a kind of some integration between internal medicine, hematology, oncology, and then some immunology that I can use like from my background as well. So my research is mainly I do some clinical research, like clinical outcome in hematologic malignancy, like leukemia and lymphoma. And my main focus on research is on the immune reconstitution and clinical outcome after bone marrow transplantation. Kind of focus more on like a subset of like regulatory T cells or T cells and see how that correlates with the immune reconstitution after transplant, how that's correlate with the outcome of the transplant. So we get to kind of pick a little bit of my background, like immunology, internal medicine, and then BMT. So
yeah, it's true. You pull way back. You got a long history of particularly on the immunology side. Is that more basic science, or are you working on the translational and clinical world?
more like a clinical world, translation and clinical. I had some experience in basic science when I was in Thailand too, but I kind of transitioned to more like a clinical research during my training.
Got it. When you think about the research here, or even if you think about when maybe back in Thailand or non-medicine at all, mentorship is really critical to kind of getting your feet off the ground, getting you in a career path. Do you have any mentors in any of your stages of life that you would like to highlight?
Good question. So I actually I got a lot of help. Even when I was in Thailand, I had a mentor, and that kind of introduced me to the field of cancer immunotherapy. And when I got here as a first year resident, I mean, I started my research kind of on the late first year residency, just spent my first 6 months just to like survive and adjust to the system. So when I got here, I know at that time, and that might be an advantage that I knew at that time that I want to do hematology, oncology. So I got to connect with one of the resident and one of the fellow, Nick Sogel, and he introduced me to a couple of mentors who still remains my mentor up to today. I mean, like Dr. Bakanova and Dr. Macron. I just had a clinic with Dr. Bakanova as of this morning. So I got to connect with them pretty quickly, and I mean, they have some ongoing research project that you can hop on, and I also like have a thought about some project that I'm not even sure if it's gonna work or something, but they are really open to my idea, and we kind of explore together if it's possible, and finally we can even get it into publication, something like that. So they're very supportive throughout the way. And I not only those two mentors, I'm still working with Dr. Sachs and Dr. Weisdorf on clinical projects too.
Got it. Well, I'm glad then, and I'm glad also that Nick, for instance, got you in the door, helped sort of, that's that fellowship, at that time as a fellow, kind of getting you looped in early so that you kind of hit the door running on the academic side.
Right, and I usually recommend like the new, like when I was in the like help with the interview for the residency program, I usually recommend like the new resident too. I think that's the easiest way to connect with the mentor. Just find someone with similar interests and get you through like either like a resident or fellow. I think that's the easiest way to get connected.
Yeah, that's true. That's how I did it when I was a resident as well. I was
Yeah.
a resident that was a year ahead of me.
Right. And like I said, like I think the research opportunity here is very broad. Like whatever you are interested in, is just basic science, clinical research, or anything. We have facility for all kinds of research.
So projecting forward a bit, thinking about finishing fellowship and in your career path, or maybe 5 or just 10 years down the road, where do you see yourself? What do you see yourself doing, whether it's geographically or career-wise, research-wise, etc.?
I hope to stay around actually. I like the program here, like that we have a strong like BMT and cell therapy basis. I'm aiming on academic career definitely. Uh, so hope to stay around in academic career, focusing maybe more on the BMT or cell therapy, and open to malignant hematology too.
Yeah, you're an academic at heart. I hear it. So with all that said, what do you like to do when it's not academic? What do you like to do that's fun, or whether it's around the Twin Cities or just hobbies in general?
Yeah, I think around Twin Cities, I mean, it's summer right now, so you can go out and do whatever, pickleball, kind of, I mean, who the things recently, and I think that sport is really exploding. Like many people is playing right now. Think around the Twin Cities, I feel that is another advantage for the Twin Cities too. That is not too, I mean, like not like Bangkok that I live in, like a very big and crowded cities. I feel like Twin Cities has everything you want to do. Just 20 to 30 minutes drive, everything is in your reach, and then I mean, very broad, very activities you want to do. I mean, hiking, I do that sometimes too. I particularly like to go up north and kind of go up to like a Superior Lakes, shores, something like that. And I mean, and that's kind of all season activities, right? Even if you go during the winter, there's still activities to do like skis and everything. In terms of hobbies, I like soccer. I used to play, not as much since I'm here, but I watch soccer pretty much every week when the season is open, which going to be this Sunday, actually this Friday actually. So I'm going to be back into the business. So I have some Thai friends here and in Rochester that I'm very close to, and we watch soccer, watch the match together all the time.
Maybe I need you to teach me. I'm gonna be coaching my youngest son's soccer team for the first time. And I admit I didn't play soccer growing up. So it'll be a learning experience for everybody. Maybe I need some
Right.
tips.
Yeah. I just play for fun too. I'm not a good player by all means.
Like I know the basics, but it was
Yeah.
not my sport of choice when I was growing up. Um, if you, I like to ask this question: if you weren't a physician, what would you be? If you weren't in medicine?
Then I might be a pilot actually.
Pilot. Okay, I
Yeah.
haven't heard that one. That's good.
It's gonna yeah, it's got kind of a bit different. That has been my interesting for quite a while. Yeah, I mean, when I was in Thailand, actually that was a time that I like exploring like a scholarship and kind of took on a jump seat on a practice flight or something like that too. If I'm not a physician, maybe I'm going to be a pilot.
We'll have Nath with his own plane soon.
Yeah, just like to kind of, I mean, get to travel, and then I think I'm kind of a bit on the nerdy on like the machine operation, like airplanes.
That's the engineering side of your academia. Oh, yeah.
Yeah.
kind of in the last question here is, as the, you know, you talk to travel. So now you're not a pilot, but you're a travel agent. Pretend you're a travel agent. Where's one place that I should go before I die, and why?
You should go, right? The place that I would recommend to you.
Yeah.
I don't know. I don't think it's gonna be anywhere in Thailand. I mean, Thailand is good to visit, but it's not that you need to go before you die.
Okay, where should I go? Maybe it's not a must-have bucket list, but where's a place that I would enjoy taking my family? I got 2 kids, that we would love to explore. We do like to world travel. We haven't been to Thailand, but there's lots of other places we haven't been to as well.
Yeah, I I mean, there are multiple places actually. I mean, I think one thing that, and that's kind of my personal opinion too. I think I'd like to see the Northern Light. So maybe go
Oh,
somewhere up north, like in the, or maybe like a midnight sun or something. So maybe up north in Scandinavia or Norway or something like that. That might be, that's very high on my bucket list too. But and
that
I
would
think
be awesome. I
somewhere
have not
like,
seen those. You know,
yeah,
and we kind of get, you know, to the audience out there who's not from Minnesota, we do tend to get into that curve where sometimes you could see the aurora borealis, but we have too many lights in the city.
right, right. I think a few months ago, like the index was strong enough that people are able to see like the northern light, like from St. Cloud or up north Minnesota or something like that. Yeah, I was too lazy to go outside late that day, but I should at some time if I really want to see the northern light. But I think the one of the bucket list that I really, really want to travel is somewhere up north in like really high north for a northern light, like a Scandinavia, Norway, or something like that.
Yeah, Norway is on our list too because my in-laws have Norwegian blood on that side too. So we'll keep that in mind. And actually one of our nurse coordinators does live further north. She's seen the Northern Lights before, and she's said the same thing. She's like, you got to get out of the cities, but then it's amazing to see.
Right.
So and thankfully it happens often enough, at least in the spring and the fall and some of the winter, that
Right. I think there's
if you're willing to get in your car and drive a bit.
I think you have to follow there's like a specific group who monitor like the Northern Light activities if you really want to jump on to their
Yeah.
way. And I think they have like it's like Facebook group or something like that. That's what I've heard. Need to
Yeah.
join them sometime.
Yeah, there we go. Yeah,
Yeah.
we'll have our Northern Lights Club within the HOT division. Well, thank you, Nath. I appreciate your time and fitting this in. It's been a pleasure to get to know about you more and continue our line of fellows and our fellows in focus. So have a great rest of the day. Enjoy the weather. It's not even 80 degrees out. It feels amazing.
Exactly.
So,
All right. Thank you so
all
much.
right. Thanks. Have a good one.
Okay. Thank you.
Bye.